Let's learn English vocabulary related to COVID-19.
Pandemic. Incubation period. Pandemic. Incubation period.
Respiratory droplets. Travel restriction. Respiratory droplets. Travel restriction.
Super spreader. Pre-existing medical condition. Community spread. Stockpile. Super spreader. Pre-existing medical condition. Community spread. Stockpile.
Mass gathering. Contact. Tracing. Disinfect. Curfew. Mass gathering. Contact. Tracing. Disinfect. Curfew.
Lockdown. Quarantine. Self-isolation. Social distancing. Lockdown. Quarantine. Self-isolation. Social distancing.
To laud. Quarantine. To emerge. To re-implement. Lockdown. The strain of the virus. To detect. Contagious. Ventilator. Critical. Diagnosis. Suspend. Setback. To quash.
Diagnose. Diagnosis. Disease. Droplets. Epidemic. Incubation period.
Infect. Infected. Infection. Infectious. Isolate. Isolation. Novel coronavirus. Outbreak.
Pandemic. Pathogen. PCR test. Person, to, person. Quarantine. SARS-CoV-2. Screening.
Super spreader. Symptoms. Transmission. Transmit. Treat. Treatment. Vaccine. Viral.
Zoonotic. Travel restriction. Social distancing. Self-isolation. Quarantine. Lockdown. Curfew. Disinfect.
Contact tracing. Mass gathering. Stockpile. Community spread. Super spreader. Pre-existing medical condition. Incubation period.
Respiratory droplets. Lung. Respiratory. Doctor. Nurse. Brave. Hardworking. Patient. Treatment.
Quarantine. SARS-CoV-2. Screening. Super spreader. Symptoms.
Coronavirus. COVID-19. Novel. Infection. Respiratory illness.
Symptoms. Symptomatic. Asymptomatic. Mild. Underlying condition. Life-threatening. Cough.
Shielding. Lung capacity. Ventilator. Sedated. Unconscious. PPE. Personal protective equipment. The COVID-19 pandemic, to be fully vaccinated, confirmed COVID-19 cases, to present an unprecedented challenge to be at risk of falling into extreme poverty, to face an existential threat, to earn an income during lockdowns, a lack of hospital beds.
To experience financial hardship, the Delta variant, to be life-threatening, to spread rapidly around the world, to develop severe breathing problems, underlying medical conditions, to cause a wide range of illnesses, a global health crisis, to halt the spread of the virus, to impose tighter restrictions on movement.
To be under the weather equals feel slightly ill. On your last legs equals a person who is on their last legs is very tired or near to death. To be out of sorts equals to be slightly ill. You're not your usual, normal self equals you're not looking or behaving as you usually do. Off color equals looking or feeling ill. Feel, look like death. Warmed up equals feel or look very ill or tired.
Wash your hands frequently with soap and water or use sanitizer gel. Catch coughs and sneezes with disposable tissues. Throw away used tissues and wash your hands. If you don't have a tissue, use your sleeves. Avoid touching your eyes, nose and mouth with unwashed hands. Avoid contact with people who are unwell.
To tip back into extreme poverty, loss of trade and tourism, to negatively affect global economic growth, significant disruptions to education, to be under the weather equals feel slightly ill, on your last legs.
To be out of sort equals to be slightly ill, you're not your usual, normal self equals you're not looking or behaving as you usually do. Off color equals looking or feeling ill. Feel? Look like death. Warmed up equals feel or look very ill or tired. Throw up equals vomit. Keel over equals fall over, especially when you feel ill. Pass out equals faint. Lost consciousness for a short time. Wear off equals, of a pain, feeling, or effect, gradually disappear or stop. Condo, calm. Go down with something equals get one of the common illness. Go around equals spread from person to person. Pick something up equals catch an infectious illness. Take things, it easy equals relax and avoid working hard or doing too much.
Make the best of it. Look on the bright side, count your blessings, rise to the challenge, grin and bear it.
Put up with, get through, resign yourself to, stoical uncomplaining.
An outbreak of STH, the Chinese city of Wuhan equals Wuhan city sore throat, dyspnea, hand wash, sneeze followed by STH, need hospital treatment, cause infection, be infected by STH, spread in other countries, pneumonia.
Runny nose, there is no specific treatment available as of now. Overexertion, drink enough water. A humidifier, avoid going near to sick people. Cover your mouth and nose when you sneeze. Stay healthy. Belong to the family of common cold and viruses, can spread from person to person, through closer contact. Transmission from infected patients to healthcare personnel.
The observed diagnosis case can only be confirmed after laboratory testing. Relieve symptom, cough, unwashed hand, share eating utensils, disinfect. The number of cases by regions and provinces, registered cases.
Speaking. 1. Talk about a pandemic you have witnessed. You should say, what was it? What is it? When did it start? How did it start? How was it controlled? How is it being controlled? 2. Talk about a situation where you had to stay indoors. You should say, when was it? Why did you stay indoors? What did you do indoors? How was the situation resolved?
I am going to talk about a health article that I have recently read. It was an article about the new coronavirus outbreak, 2019 nCoV, and basic protective measures against it. The first part of the article was the general description of the epidemic. The 2019 novel coronavirus is a new form of the coronavirus family that causes pneumonia in humans. It originated in China in December 2019 after a cluster of pneumonia cases in Wuhan, China. Although the first cases had been recorded in December 2019, not until January 2020 was it revealed to the general public, petrifying the whole world with its highly contagious nature. Shortly thereafter, quarantines and travel bans were implemented around the world, many schools are closed, and people start wearing masks when going outside. From the article, I was informed that the symptoms of the disease include coughing, fever, difficulty breathing, and possible lesions on both lungs. Some pieces of advice on how to protect ourselves from the virus were also provided. Those include washing hands frequently with soap and water, or an alcohol-based hand rub, maintain social distancing and avoid touching eyes, nose and mouth. Believe it or not, the article also stated that wearing masks is generally ineffective for those who have yet to show symptoms.
Thanks for watching.